About 3 weeks now, we've been conducting series of tests, basically or specifically for hypertension and the high blood sugar level or blood sugar level. I want to surprise you people. The first day, that's 2 weeks ago, we conducted tests for about 9 people. Lo and behold, out of these 9, 6 were hypertensive. Yes, 6 were hypertensive. And 1 was very, very critical. That if it is in the hospital setting, the person needs admission. I am emphasizing on this to tell us how hypertension have eaten deep into our bodies. And this is one of the problems that we do neglect. Even after health talk on hypertension, people don't even adhere to the instructions, which is very, very bad. Bad in the sense that hypertension is one of the causes of stroke. And if you have seen anybody that suffered of stroke, you will not pray for your enemy to pass through such problem. So I want to take us on the causes of stroke. But before, let me tell us what is stroke. What is stroke? Stroke, when we hear stroke, what is stroke? I think it's better, let me just use pidgin so that all of us will benefit. Stroke occurs when your brain lack or is not being supplied with blood. We know that blood carries oxygen and nutrients. The heart distributes to all the parts of our body. It is this oxygen and nutrient that they survive with. So when brain is deprived of the nutrients and the oxygen, stroke happens. We have 2 types of strokes: ischemic and hemorrhagic. Hemorrhagic means that the blood vessels in the brain they rupture, thereby allow blood to be going direct into the brain. And we have ischemic. That ischemic is when there is a blockage and the blood is no longer flowing to the brain. We know in the brain, the vessels are very, very small, very, very tiny, that anything can obstruct flow. So when it happens like that, stroke happens. So what are the signs of stroke? We should be on the average, and we should not even wait to have these signs at all. Because if we start having these signs, it means we are very down. The thing don't catch us well. Let us not allow it to catch us before we find solutions. And how can we avoid it? We have known that high blood pressure is one of the causes of stroke. We should always check our blood pressures. We should always, if we identify with any type of hypertension, we should be on medication and be in touch with our doctors at every point of time. So, causes of stroke, hypertension, what is hypertension? Hypertension is the pressure that the blood exerts on the blood vessels that carries it. We know God has a kind of network of pipes in our bodies. And when the heart pumps the blood, you follow this pipe to every part of our body, even to the brain. So that pressure, like you open pipe water, you see, that is the pressure. So this pressure is exerted on the walls. When it is high, it becomes hypertension. What makes it to be high? When the blood is not flowing normal again in those blood vessels due to some obstructions, that make it high. So in this, that is high blood pressure anyway, one of the causes of stroke. Then another one is heart disease. When your heart is diseased, When your heart is diseased, it can cause you stroke. How do you know that your heart is diseased? Sometimes you will have pains, and you'll be enduring that pains at the side of your heart. The person, even if you have pain, from 40 years, start checking these series of tests. Start going to the test. Check X-rays, ECG. All these things will tell you whether you have problem with your heart or not. Because this, if you have it and you ignore it, it will cause you stroke. Then another one is cholesterol, high cholesterol. We have two types of cholesterol, low density and high density. So the low density is one that causes problem. So when you check through laboratory, they will tell you have cholesterol, and drugs will be prescribed for you. So that this cholesterol is fat. Cholesterol is fat. As blood is going to be depositing this fat into your blood vessels, the side of your blood vessels, thereby occluding, narrowing the passage of blood. And when it happens, it causes you high blood pressure. Then diabetes. If you have the diabetes, don't neglect your drugs. Always be in contact with your doctors. Because diabetes, the sugar in your body are being deposited into your extremities. That is your fingers and your fingernail, both hand and the leg. So when they are being deposited, you will not allow blood again to be flowing. And even your blood vessels, equally, these sugars will be depositing there. So it will cause your blood pressure to be high. Then another one is smoking. If you are the one that smokes, smoking can cause you stroke because smoke affects your lung. When your lung is being affected, your heart equally will be affected instantly. Then excessive alcohol. When you are drinking to stupor, stroke can happen to you at any time. Because drinking affects your brain, affects your heart, all your system will be affected. Even your kidneys will be affected. Your liver will be affected. So it's better we avoid alcohol. Because if you say, let me take small, from small, you start taking big. So for our health, it's better we avoid it. Sometimes they say, Seventh-day Adventists, their own is too much. Don't drink alcohol. Don't smoke. What will be that? This is created for consumption. If it's not for your God, because you are worshiping your God, because of your health, so that you will not die early. So, brain aneurysm. What do I mean by this? If you take, you see, in these blood vessels I said, sometimes they will come like you blow, they will swell up, and from there they will break. And when they break, then blood will start seeping into your brain. And once brain starts seeping into your brain, what happens? Unconsciousness, and that is stroke. You become stroked. So carotid artery, there's two arteries here. These two arteries supplies the brain with the blood. When anything happens to them, when they are occluded, when anything blocks them, definitely you are going to have stroke. So this is some of the causes of stroke. And let us not forget that anybody that has stroke, the life expectancy of that person is between 1 month and the 7.5 years. That is life expectancy. For you, like we are talking of types of stroke, if you have hemorrhagic, depending on your age, you will not last up to 3 months. If you have this type of stroke. But that is ischemic. Depending on your age too, you can last up to 7 years. Sometimes there's one called transient ischemic attack. They say it's partial stroke. That stroke, even without medication, even without any attention, you can recover. But that you recover does mean that you are well. You have to take care of yourself by taking your drugs, checking your BP at all times, and follow up with your doctor's appointment. That is the only way you can be safe and prevent from falling into the main stroke. So the Health and Temperance Health and Temperance of the Adventist Church always emphasize on this stroke and the hypertension because how it is ravaging not only Nigeria but the whole world. So, with this, please let us always be on the check. Check ourselves. If we are identified, let us take our drugs for longevity. Life has no duplicate. And when somebody dies, and as you hear this message, don't keep it. Pass it to your neighbors. Pass it to your brothers. Pass it to your sisters. Pass it to your relatives. Even your enemies, pass it to them. You are equally preaching the word of God. Thank you very much.